Welcome back to our channel. Today, we're examining the AURORA trial and whether rosuvastatin can reduce cardiovascular events in patients with end-stage renal disease on hemodialysis. Let's dive into the findings. Patients with chronic kidney disease face an increased risk of cardiovascular disease, and this risk escalates significantly in those with end-stage renal disease undergoing hemodialysis. Despite the proven benefits of statins in the general population, their effectiveness in reducing cardiovascular disease events for end-stage renal disease patients remains unclear. Adults with end-stage renal disease on hemodialysis experience a staggering 10 to 30 times higher incidence of cardiovascular events compared to the general population, with about 11 events per 100 patient years. Statins have been shown to reduce cardiovascular events in high-risk populations in several landmark trials. But the 4D study in 2005 raised questions about their benefit for patients with diabetes on dialysis. The AURORA trial, published in 2009, sought to clarify the benefit of statins for the general end-stage renal disease population. It enrolled 2,773 patients on hemodialysis and randomized them to either rosuvastatin or placebo. The primary outcome was a composite of cardiovascular mortality, non-fatal myocardial infarction, or non-fatal stroke. After a median follow-up of 3.8 years, the study found no significant difference in the primary outcome between the rosuvastatin and placebo groups. The incidence rates were 9.2 versus 9.5 events per 100 patient years, respectively. This indicated that rosuvastatin did not significantly reduce cardiovascular events in patients with end-stage renal disease on hemodialysis. The secondary outcomes, including non-fatal myocardial infarction, stroke, and all-cause mortality, also showed no significant differences. Additionally, rosuvastatin did not reduce cardiovascular events or death in patients with end-stage renal disease on hemodialysis. These results align with findings from other studies. These results align with findings from the SHARP trial, which showed no benefit of statins in the dialysis subgroup. Two Cochrane reviews confirmed that while statins are beneficial for pre-end-stage renal disease chronic kidney disease stages, they don't provide the same benefits for patients on hemodialysis. Based on these findings, the Kidney Disease, Improving Global Outcomes, or KDIGO, guidelines suggest not initiating statins in patients on hemodialysis. However, they recommend continuing statin therapy if patients were already on it when starting dialysis. This nuanced approach helps tailor treatment to individual patient needs. In summary, the AURORA trial shows that rosuvastatin doesn't reduce cardiovascular events in end-stage renal disease patients on hemodialysis. The role of statins is significant in earlier chronic kidney disease stages, but not for those on dialysis. This underscores the need for different strategies to manage cardiovascular risk in these patients. Thanks for joining us today. If you found this video helpful, give it a thumbs up and subscribe for more updates on kidney and cardiovascular health. See you next time. Stay informed, stay healthy,